Hello friends, welcome to my YouTube channel. Today we are going to discuss about a very important topic from orthopedics, that is bone tumors. The bone tumors are classified as benign and malignant bone tumors. Whenever we are studying about bone tumors, we need to keep two things in our mind. Part of the bone from which tumor arises, that is epiphysis, diaphysis or metaphysis, and the most common location of it. Well, having said that, let us begin with our discussion. The first benign bone tumor that we are discussing here is unicameral bone cyst, UBC. See, this is the X-ray of UBC. It arises from the metaphysis of the long bones, and the most common site is upper end of the humerus. Both are shown in the X-ray here. This is metaphysis of the humerus, and the central cavity filled with straw color fluid is unicameral bone cyst. The single central cavity filled with straw color fluid, it is also known as simple bone cyst. There are few signs: trapdoor sign and falling leaf sign. See, this is falling leaf sign, and the treatment here is curettage plus bone grafting. Now let us move to the another bone cyst, that is aneurysmal bone cyst, ABC. This also arises from metaphysis, and the most common site being upper end of the tibia. See here, a multiloculated cyst present in the upper end of the tibia. See here one typical eye-striking finding, that the epiphysis is not fused with metaphysis yet. That means this aneurysmal bone cyst presents to you before skeletal maturity. That means this aneurysmal bone cyst presents to you before skeletal maturity, usually in the second decade of life. Okay, this arises from the metaphysis of the long bones, most common site being upper end of the tibia, presents before skeletal maturity, usually in the second decade of life, and this is a multiloculated eccentric and expandable tumor. On MRI, you see fluid sign. This is MRI of the aneurysmal bone cyst. This is MRI of the aneurysmal bone cyst showing fluid sign, and the treatment is extended curettage, and this is a vascular tumor, so you can consider embolization also. Now let us move to the another tumor, that is exostosis. This is the most common benign tumor, and this arises from the diaphysis of the long bones. See, this is the exostosis. That is, from the diaphysis of the long bones, there is outgrowth of the bone, and over that bone, a cartilage cap is present. It On clinical examination, there is a massive swelling, but on radiological examination, there is only small outgrowth of bone is seen. So, see, you can see here also. Epiphysis is not fused with metaphysis. That means this also presents to you before skeletal maturity. This is diaphyseal achalasia. This is also called as diaphyseal achalasia. It presents before skeletal maturity, and it presents with pain due to bursitis overlining and a neurovascular compromise or fracture, and because of malignant transformation. Oh, this osteochondroma or exostosis undergoes malignant transformation. This is very important. And how to suspect in a case of exostosis whether the malignancy has developed or not. So there are few indicators which tell us that there is malignant transformation or not. They are cartilage thickness more than 2 cm, rapid increase in size, and growth after skeletal maturity, and loss of differentiation. All these 4 points tell us that there is malignant transformation. And there are few conditions associated with exostosis. First one is Trevor'S disease. Trevor'S disease is nothing but intra-articular epiphyseal osteochondromas. Usually osteochondromas are diaphyseal, but here epiphyseal osteochondromas, that too intra-articular. Intra-articular epiphyseal osteochondromas are seen in Trevor'S disease. And there is one more condition known as multiple hereditary exostosis. It is associated with EXT1 and 2 genes, and here malignancy risk is high, that is up to 5% malignant risk is there. Treatment of exostosis is extraperiosteal resection. Now let us move to the another tumor, that is osteoid osteoma. Osteoid osteoma arises from the diaphysis of the long bones, and it is a cortical tumor. It has a central lytic lesion with surrounding sclerotic margin. That central lytic lesion is known as nidus, and nidus is surrounded by sclerotic margin. It is a diaphyseal tumor. It's a cortical tumor, and it classically presents with night pain relieved on taking salicylates. There is a central lytic lesion known as nidus with sclerotic margin, and treatment here is radiofrequency ablation, and there is a peculiar osteoma known as ivory osteoma or compact osteoma or shunted osteoma. Now let us look at Codman's tumor. Codman's tumor arises from the epiphysis of the long bone. See, you can see here epiphysis of the humerus, and common site being upper end of the humerus. This is also known as chondroblastoma, and you can see on histology, you can see chicken wire calcification, and it also presents before skeletal maturity, and treatment here is extended curettage. See, this is chicken wire and this is chicken wire calcification seen in chondroblastoma or Codman's tumor. Now let us look at the one more interesting tumor, that is enchondroma. Enchondroma is pre-malignant condition, pre-malignant benign tumor. Malignancy risk is 5%, and this is the most common bone tumor of the hands and feet. This also arises from the metaphysis. See here, this is enchondroma. Again, there are few conditions associated with enchondroma, that is Ollier's syndrome. Ollier's syndrome, you will see multiple enchondroma, and up to 30% malignancy risk is there. And in morphosis syndrome, 100% malignant. Morphosis syndrome is a 100% malignant condition. It is characterized by multiple enchondroma plus hemangioma plus phlebolytic. The treatment of enchondroma is extended curettage. See, this is how Ollier's syndrome looks like on clinical picture, and on taking X-ray, this is how it looks. Well, next tumor is vascular tumor of bone, and it involves vertebrae. Vertebrae on hemangiomas of vertebra on taking cross-sectional view, CT cross-section, we get to see this polka dot sign. These are your polka dots, and you see polka dot sign on cross, and you see polka dot sign on cross section of the vertebrae. On sagittal section, you see corduroy appearance or jail bar appearance. This is corduroy cloth, and you are seeing jail bar appearance or corduroy appearance. Well, this is it for this video, and if you want me to cover any of the topic, let me know in the comment section, and I will come up with that video very soon. Thank you for listening. Thank you for watching. All the best.